So let's look at type 2 gyno. Let's bring up this patient. Again, I think most people would say, there's nothing wrong with this. This is something that can be, easily ignored, I guess, for lack of a better term. You can just get on with your life and move on. But again, this affected this patient terribly. He even went to another surgeon, a general surgeon. As you can see, these kind of horizontal marks above the top of the nipple that tried to do some type of surgery to reduce this, and left him with a horrible scar, in a sense that it's just poorly placed. It's not too bad as far as healing, just poor placement and obvious scar. But nonetheless, this patient has asymmetric or uneven fullness to his chest. It causes him embarrassment when he wears certain clothes. It will not allow him, or he will not allow himself to wear certain clothes. And he may or may not take off his shirt at various points where it's something that's reasonable. At the beach, in front of his significant other, doing intimate sessions, what have you. He just doesn't feel good about it. So as you can see on our right of the screen, that breast, for lack of a better term, it's got a little roundness, a little fullness. Not bad, but it does have a little roundness to it. On the left of the screen, it has a little more fullness and a little bit more droop. As you can see, the nipple level is uneven. So it has a little excess skin, not a ton. It definitely has more breast tissue than normal or average, and it probably has a bit of fat as well. So in this case, unlike the first case where we just removed the breast tissue and not any fat, not any skin, we're going to have to remove some breast tissue and some fat.